Prostate cancer is an immunoevasive disease. In other words, prostate cancer cells can evade or inhibit the body's normal immune processes. This immunoevasive ability helps make it possible for cancer cells to grow and spread largely unchecked. Provenge is an innovative treatment that uses a patient's own cells to stimulate the body's immune system to fight prostate cancer. Let's see how this is done. In order to manufacture Provenge, immune cells are collected from the patient. Antigen-presenting cells, or APCs, are a key component of these immune cells. Once collected, the cells are sent to a dendrion manufacturing facility, where the APCs are exposed to a recombinant antigen that functions as a prostate cancer-associated antigen. This recombinant antigen consists of two key components. The first is prostatic acid phosphatase, also known as PAP. PAP is a protein that is highly expressed in more than 95% of all prostate cancers. The second key component of the recombinant antigen is an immune cell activator called granulocyte macrophage colony stimulating factor, or GM-CSF. When this PAP-GM-CSF antigen is cultured with the patient's resting APCs, the APCs digest and display pieces of it on their surface. This results in APC maturation. This process is done outside of the patient's body to avoid the immunosuppressive environment created by the prostate cancer cells inside the body. Provenge is designed to induce an immune response against PAP. Let's take a closer look. Of the many different immune cells that are involved in detecting and destroying prostate cancer cells, the strongest defense is the activated T cell. The PAP-GM-CSF loaded or matured APCs that make up the active component of Provenge are designed to activate T cells. Once activated, these T cells multiply and move through the patient's body, now able to recognize and target prostate cancer cells. This T cell-mediated response is a key strategy in the fight against prostate cancer. Dendrion continues to investigate this innovative approach to treating cancer in other tumor types. Provenge, Sipuleucel-T, is an autologous cellular immunotherapy indicated for the treatment of asymptomatic or minimally symptomatic metastatic castrate-resistant hormone-refractory prostate cancer. Important safety information. Provenge is intended solely for autologous use and is not routinely tested for transmissible infectious diseases. In controlled clinical trials, serious adverse events reported in the Provenge group include acute infusion reactions occurring within 1 day of infusion and cerebrovascular events. Severe grade 3 acute infusion reactions were reported in 3.5% of patients in the Provenge group. Reactions included chills, fever, fatigue, asthenia, dyspnea, hypoxia, bronchospasm, dizziness, headache, hypertension, muscle ache, nausea, and vomiting. No grade 4 or 5 acute infusion reactions were reported in patients in the Provenge group. The most common adverse events, incidence greater than or equal to 15%, reported in the Provenge group are chills, fatigue, fever, back pain, nausea, joint ache, and headache. For the full prescribing information, go to www.provenge.com or call 1-877-336-3736.